Adalimumab, also known as Yuflyma, cf. Autoinjector Crohn's UCHS starter 80 mg per 0.8 ml subcut kit, is a medication used to reduce pain and swelling caused by certain types of arthritis, skin disorders, bowel conditions such as Crohn's disease and ulcerative colitis, and a certain eye disease called uveitis. It works by blocking a protein in the body's immune system that causes joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. By reducing joint swelling, this medication helps to reduce further joint damage and preserve joint function. The recommended daily dosage for Yuflyma, cf. Autoinjector Crohn's UCHS starter 80 mg per 0.8 ml subcut kit is determined by your healthcare provider. It is important to take this medication at the same time each day to maintain a consistent level of the drug in your body. Be sure to follow your healthcare provider's instructions carefully and do not change your dose without consulting them. Be sure to read the medication guide and instructions for use provided by your pharmacist before you start using Yuflyma, cf. Autoinjector. If you have any questions, ask your doctor or pharmacist. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. If you are using this medication to treat a specific condition, such as Crohn's disease or ulcerative colitis, your doctor may prescribe a different schedule or higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Use this medication regularly to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. Some common side effects at the injection site include redness, itching, pain, or swelling. If these effects persist or worsen, inform your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it is important to contact your doctor immediately if you develop signs of infection, such as a persistent sore throat or cough, fever, chills, night sweats, or trouble breathing. Additionally, notify your doctor if you experience any serious side effects such as changes in heart rate, symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising/bleeding, numbness or tingling, vision changes, joint pain, or a rash on the nose and cheeks. It is important to seek medical help right away if you experience symptoms of liver damage, including nausea, vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine. Furthermore, contact your doctor immediately if you experience very serious side effects such as seizures or chest pain. While a serious allergic reaction is rare, seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, contact your doctor or pharmacist. This medication can weaken your body's ability to fight infections, which can lead to serious, possibly fatal infections. Tell your doctor if you have a history of infections, have traveled to areas with certain fungal infections, or have been near someone with tuberculosis. Your doctor will test you for tuberculosis before and during treatment. There is a small risk of developing cancer while using this medication, especially in children, teens, and young adults. Discuss the risks and benefits with your doctor and report any symptoms of infection or cancer immediately. Before starting Yuflyma, cf. Autoinjector Crohn's UCHS starter 80 mg per 0.8 ml subcut kit inflammatory bowel agents, it's important to talk to your doctor about any allergies you may have, including allergies to adalimumab or other similar products. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's important to also discuss your medical history with your doctor or pharmacist before starting this medication, particularly if you have had recent or repeated infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, or heart disease. Adalimumab can increase your risk of getting infections, so it's important to avoid contact with anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. Before receiving any immunizations or vaccinations, be sure to let your healthcare professional know that you are using adalimumab. It's also important to use caution with sharp objects and avoid contact sports to lower the chance of getting cut, bruised, or injured. And before any surgery, be sure to inform your doctor or dentist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. It's important to note that older adults may be at greater risk for infections and cancer while using this medication. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. And if you are breastfeeding, be sure to consult your doctor before starting this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Yuflyma, cf. Autoinjector Crohn's UCHS starter 80 mg per 0.8 ml subcut kit. Inflammatory bowel agents include other TNF blockers, such as etanercept, Infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important not to share this medication with others. Your doctor may also require you to undergo lab and/or medical tests, such as a complete blood count and liver function tests, while you are using this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, make sure to speak with your doctor or pharmacist to figure out when to take your next dose. Do not take a double dose to make up for the missed one. When storing Yuflyma, cf. Autoinjector Crohn's UCHS starter 80 mg per 0.8 ml subcut kit. Inflammatory bowel agents, it is important to keep it in the refrigerator, but do not freeze it. Some brands may be stored at room temperature, so be sure to check with your pharmacist or product package for specific instructions. Once stored at room temperature, do not put it back in the refrigerator. Keep the medication in its original container to protect it from light, and discard any unused portion. It is important to keep all medications away from children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.